Everyone again. For those of you that were at the kickoff meeting, for those of you that weren't, hi, I'm Laura. Nice to meet you. All right, so let's get started. Before we start, we like to start with our land acknowledgement. So acknowledging for myself the surrounding traditional lands of the Cotsapsum, or Esquimalt, and the Kwangin Songhees Nation, where I work, live, learn, and play. As for our agenda, I mentioned this during the kickoff meetings, but just want to reiterate that each of these modules is slotted to be an hour with about 40 to 45 minutes of presentation and about 15 to 20 minutes for discussion. For this one, we're going to save the discussion for the end of the presentation. So if you do have any questions as I'm going through some of the material, please just feel free to pop them in the chat and we'll be sure to get a response, maybe not an answer, but a response to you in that time. I also just wanted to take this opportunity at the beginning to reiterate that with this being a pilot program, we are learning together, and I really welcome any and all feedback that you might have about the format, the content, etc. I come from a background of managing a yoga studio, and our rule was always, you should always never give feedback unless you've been asked to give feedback. And the second rule was always ask for feedback. So I really do live by that and want your feedback throughout the course of the year, not just as a reflection in the end. We want to better this program as we're going through. So we really do have a wonderful group of project leads in this cohort, and you all have experience with this field, whether that be content or context knowledge through working in schools, being a parent yourself, or in your day jobs, and maybe a combination of those. So as a result, there may be things through this curriculum that you already know. So bear with me through those refreshers. And then my hope really is that with each one of these modules, there's always something or maybe many things that you do learn. And I also welcome you to share any further insight into the topic areas that we discuss, because I know you have resources and related experiences that you can share with this group as well. So as for the actual agenda, really when I was thinking about how to reshape the curriculum from last year, thought about beginning the program, wanting to start with a module that would really give context and hopefully help everybody determine the why behind what we're doing with this pilot program. So the goal is that within the content of what I present today, you as a project lead are more able to define your why and inspire your students, parents, teachers, et cetera, in your school community to discover their why for engaging in more active school travel. Simon Sinek is a leader that talks a lot about how great leaders inspire action. And in looking at the pattern of great leaders, he determined that the most inspired and inspiring people and organizations are ones that think, act, and communicate in the same way. They start with their why. He always says, people don't buy what you do, they buy why you do it. And though why doesn't necessarily close a deal, your why is what opens the conversation, allows people in, and ultimately drives human behavior. So I'm having to pan back and forth here. First, we're going to just get into a little bit of background, a little bit of history, some of the things that I alluded to during our kickoff meeting there. So the ecological models framework really argues that population health is influenced by attributes of people, attributes of the environment, and the interactions between them. So another way to think about that is known as reciprocal causation, the idea that human behavior influences and is influenced by the built-in social environment. And then it follows that the two approaches that are associated with this ecological perspective are to either change people's behaviors or change the environment. And the most powerful interventions address both and are based on a clear understanding of the desired health behaviors and their environmental context. So documented behavioral assumption here is that lifelong health behaviors and physical activity patterns are established during childhood. Children that travel by personal motor vehicle are more likely to do so as adults, whereas using active transportation methods to school as a child establishes healthy habits and decreased reliance on passive transportation during adulthood. Here you can see this awesome map. It's from the UK. There are similar patterns that have been observed here in North America, but I couldn't find an image that actually showed that was based in North America. So this one is from Dr. William Bird. It's also presented in Tim Gill's book. He presented on this recently with a webinar on 8 to 80 cities, and he writes about it in his book called Urban Playground: How Child-Friendly Planning and Design Can Save Cities. And I just want to mention a caveat here is that while many urban planning books tend to focus on cities, the underlying notions are really transferable to suburban, semi-rural, and rural contexts. So if you're not a city school, don't worry, this is still applicable. So in this diagram, you can see the roaming range of an 8-year-old child from 4 generations in the same family. So here in 1926, the great-grandfather was allowed to walk 6 miles on his own to go fishing. By 1950, his son was only able to roam about 1 mile to go to the forest on his own. And by 1979, his granddaughter, the mother, was allowed to walk about half a mile on her own independently to go to a swimming pool. And by 2007, his great-grandson at the age of 8 was only allowed to go 300 meters to the end of his street on his own. This really showcases that shrinking horizon of childhood and the change in childhood behaviors because of the way that we build towns, cities, neighborhoods, and the shift in social environmental factors. And I'm going to circle back to this document if we have time, or to this diagram if we have time at the end. Going along that note, I told you guys in the kickoff meeting you would see some of these things that you described, how you used to walk to school, but you don't see that happening a lot now in your children. So here is American data. It shows real inversion there. So in 1969, the odds were that your child and you, or sorry, the odds were that you walked to school. 12% of the population was actually driven in 1969. But by 2009, the odds are that your child is driven to school, with only 12% of the population walking to school. So really, in one generation, we've completely inverted the way that we move about, with an increased dependence on motor vehicles. This is the best Canadian data that we could find. It's combined data from the Greater Toronto Area and Hamilton. So on those solid lines there, you can see data that captures males and females 11 to 17 years old. And then the dotted line is actually from Student Transportation Services of Waterloo Region, who do a lot of work in school travel planning, and that's the reported data from the schools that they work with. But essentially just to show that you see that same inversion, that same generational shift away from active transportation, with driving significantly increasing and walking or active transportation dropping. So all in all, in North America, we have completely shifted from a society where children walk to school to one where children are driven to school. And the hopeful message is that we can really shift that back. So Jennifer Keesmaat talks about this in her TED Talk, and she really says, walking to school is a simple, hopeful, and powerful act. And I've linked her TED Talk in the previous slide, so if you wanted to watch that, you can follow me. All right. This section is called the why because it really outlines 4 big reasons why we're doing this work, but I do really want to reiterate that the entire module is considering the why. All right, children's safety. First and foremost, we cannot have active travel when it is not safe for children. That's why this is listed as the first and foremost reason. So as I mentioned during the kickoff meeting, the provincial goal that we're kind of helping to work toward, and I believe our program can contribute to, is adopting Vision Zero, which is what sees no fatalities or serious injuries resulting from collisions or crashes on the road. Road traffic collisions are the leading cause of injury death among children and youth in Canada, age 1 to 19. And 2 key aspects that influence pedestrian motor vehicle collisions are traffic volume, which increases the frequency of the collision, and traffic speed, which increases the severity of the injury. So the fact is that increased car use makes school zones congested and less safe for children. And congestion and unsafe driving behaviors are common during school bell times. Just to paint this picture, I tried last week, thought I'll just do a quick Google search, and it brought me to all of these news stories that are just within the last 2 months. So the first one being a child in Kingston, Ontario that's 10 years old who was hit at 3:40 p.m. as she was leaving school. Article there, January 31st. The second was a young girl that was hit in a crosswalk here in Saanich, where I live, on a crosswalk on her way to school in 2017, and talking about how that is still an ongoing thing that her parents have to deal with. The child is actually still in a vegetative state, and they're still going to court fighting the person who hit her. So all this to really say, like, it should not take death for measures to be taken to make schools safe. We know this. We need to do what we can as a group, as a collective with this pilot to ensure that preventative measures are in place and parents in the larger community are educated on why, so that incidents like these never occur. There's also a 2011 study in Toronto that was born out of data on children that were involved in pedestrian motor vehicle collisions near schools. And that study observed dangerous driving behaviors at 118 elementary schools. So dangerous driving behaviors were observed in the course of the study over at 88% of these schools. And the three most common that parents saw were dropping their kids off on opposite sides of the road and then letting them jaywalk, parents leading, like blocking the view of pedestrians and other cars, and then double parking. And they found that each of these dangerous driving behaviors during the school drop-off period was associated with a 45% greater risk of collision. Second reason, children's health. Participation report card on physical activity for children and youth, you might be aware of it. It's put out every year, and it's really the most comprehensive assessment that we have here in Canada about child and youth physical activity, and synthesizes data from multiple sources, including the best available peer-reviewed research to assign evidence-informed grades. They give grades across different performance indicators, and we've been at a solid D- in active transportation for a very long time. So in this slide, you'll see the breakdown of school travel based on parent and self-reported data for 5 to 19-year-olds in Canada. It's important to note also just perhaps that cycling actually makes up a very small percentage of active travel in school, though it tends to take up a lot of the way that we speak about it. And for context and perspective, I was doing my master's thesis work on active school travel 10 years ago, and the numbers were 24% active, 62% inactive, and 14% combination. So not much has changed, but it has gotten slightly worse. And then in the physical activity data here, the bottom line really is that children are not accumulating enough physical activity to improve their health. The COVID-19 pandemic has really exacerbated this: lower physical activity levels, less time outside, higher sedentary behavior, and insufficient physical activity, as most of you likely know and are behind, is that insufficient physical activity really leads to adverse health effects such as weight gain, injury, poor mental health, chronic disease, obesity, cancer, type 2 diabetes, and stroke. Moving on from children and looking at the bigger picture of the environment here. In 2019, British Columbia's gross greenhouse gas emissions, as reported in the provincial inventory, were 68.6 million tons of carbon dioxide equivalent. This is an increase of 5% from the 2007 numbers, which is our baseline year for emission reduction targets. We do have a long way to go to hit our provincial legislated reduction targets, which are 16% decrease below those 2007 levels by 2025. So if you imagine we're sitting at 2022, and in 2021 we were 5% higher, we've still got 21% to go. The helpful, good information here that's both good and bad news, I suppose, is that the transportation sector produces the largest amount of greenhouse gas emissions in BC. And within that transportation sector, passenger transport, car, trucks, motorcycles, et cetera, and freight transport, such as heavy-duty trucks and rails, produce the most emissions. So as such, you can extrapolate that shifting to active transportation for many journeys as possible represents a really huge opportunity for these reduction targets to be met. And this links to our objective of supporting Move, Commute, Connect, and particularly the province's goal of doubling the number of trips taken by active transportation by 2030. Environmental stuff is linked to air quality. So I love this little quote that I saw in a news article. It said, "There are a lot worse things than cooties floating around the kiss and ride area at most schools." Kiss and ride is a common intervention, but is it good? The use of private vehicles can really significantly increase local concentration of air pollution, regardless of background conditions. So meaning that there's a halo of air pollution around these zones, and it even extends to the playground areas nearby in the school, regardless of whether that school is rural, urban, or suburban. So students who spend time around designated pickup zones end up breathing in higher levels of pollution from these idling cars that are nearby. And children are particularly vulnerable to air pollution because they breathe faster than adults and inhale more air per kilogram of their body weight. So children experience the negative impacts of air pollution at lower concentrations of that air pollution compared to adults. And there's also another Toronto study that found that pollution concentration is of particular concern for kindergarten students, whose play areas are often located closest to those school drop-off zones. So when it comes to air pollution in children, public health information, some of you are here today from public health, information really outlines that two pollutants are especially important: ozone and particulate matter. And studies have really identified that ozone causes short and long-term respiratory damage to children, including asthma, and that children suffer many negative health consequences, including allergic reactions, as well as reducing their cognitive development, which can then have lifelong socioeconomic altering outcomes. The heart, brain, hormone systems, and immunity can all be harmed by air pollution, and research is now beginning to point towards effect on growth, intelligence, and development of the brain and coordination. So there's another study of freshmen at the University of California, Berkeley, found that students who had grown up in areas with higher ozone exposure, like in the LA basin, had diminished airflow in their small airways compared to those students who had grown up breathing cleaner air, say from the San Francisco Bay Area. There's another California children's study that followed about 3,500 children for 5 years, and they found that student athletes in high ozone communities had 3 times higher risk of developing asthma than their counterparts in lower ozone communities. So it feels like I'm starting on a pretty daunting note, but it's important, I think, to outline those key factors. And with all of this in mind, remembering that we really do have an incredible opportunity to shift behavior patterns so that more children and families are choosing active travel, not just for its own sake, but to improve the overall health and well-being of children, the environment, and all the while increasing the safety of our built environment. We have an opportunity. Children attend school, right, 5 times a week for 10 months of the year. So big number of trips happening there. Important to define what we mean by active travel. And many of you are familiar with this. Active travel refers to all human-powered forms of travel. So using our bodies as a primary means of movement from one place to another and not involving fossil fuels. Walking and cycling are most common, running, scootering, skateboarding, etc. You know the drill there. But important to note here is that we also define active travel as to include a partially active trip. So if you're taking, say, a drive to 5 approach when a child is dropped off a 5-minute walk away from the school and then finishes the trip actively, or when a child takes the bus and then walks or uses human-powered transportation on their way from the bus to school or on their way to the school, from home to the bus stop. Benefits. This awesome infographic you would have seen if you had attended our info session. And really one of the things that I love most about this field is that it comes with multifaceted benefits and can appeal to different people for so many different reasons. So there can be many whys that inspire families to engage in active transportation. For example, people may choose modes of travel because of the physical health benefits, maybe improved mental health, maybe a desire for greater community connectedness, improved learning outcomes, lessening their environmental footprints, or in an effort to build more childhood autonomy. Maybe it's a combination of or all of those reasons. Active school travel programs have been shown to be successful in supporting a number of positive outcomes. On the health side, children who engage in active school travel have shown increased emotional and mental well-being, increased self-efficacy, self-esteem, and happiness, decreased anxiety, depression, and stress. Active school travel before school can increase a child's ability to concentrate, and some studies have shown that this effect lasts about 4 hours. So it really does take them to that time at lunch when they can be active again. Physical activity has been shown to improve school grades, classroom behavior, cognitive skills, concentration, memory, verbal skills. In other words, increased alertness, academic, and cognitive performance. They also tend to engage in more physical activity. So if you are someone who walks to school, then it's then shown to inspire those children to be more physically active outside of those times, leading to decreases in BMI, better patterns of sleep established. And as we've discussed already, the environmental benefits are really plenty: reduced emissions, improved air quality, lower risk of lung and cardiovascular disease. Active school travel programming has benefits that extend also out to the community. So you see friendships fostered, an increased sense of belonging, social connection, better understanding of the local area. It really does afford children the opportunity to learn about the built and natural environment. And children that walk to school gain self-confidence and a sense of responsibility. Exploring environment on foot is really an important part of childhood development. And walking to school develops that spatial awareness, independence, self-sufficiency, and resilience. As Jennifer Keesmaat says, ultimately, it is a rite of passage. And safety improvements in and around school zones are also a benefit for the entire community. So when we reduce traffic volume, creating safer school zones, improving walking, cycling routes, that enhances the safety, connectivity, and quality of life for your community as a whole. So in other words, active transportation, active school travel is healthy, clean, safe, educational, affordable, and fun. Most importantly, fun. The school travel planning process. Okay, so to be clear, we're going to be spending more time on these steps of the school travel planning process throughout the modules, but I wanted to start with an overview of the process. And it's important to note that typically this process can take 2 to 3 years for schools to complete. So we really don't expect that you complete your entire school travel plan in its entirety, this pilot, but we do want to see a solid effort put in. And if you do it, great, kudos to you. We really do understand, though, the limitations of being a one-year pilot during a pandemic, and know that you don't need to do everything, but let's work on starting to put those building blocks in place. So what does this look like? The school travel planning process you can see here on the slide, we've brought forth with permission from our colleagues at Ontario Active School Travel, which operates under the umbrella of Green Communities Canada. You may be familiar with them. It is also the model that the former HASTE BC used. School travel planning is a community-based approach. It's intended to increase the rates of active school travel by encouraging students that are in the walk zone to walk or wheel, and students that are in the bus zone to ride the bus. This approach addresses issues and incentives that exist locally, and it's comprehensive, yet flexible enough to work in a variety of settings. So inner city, inner and outer suburbs, rural areas, semi-rural areas. It's really been used with success at schools from these diverse locations across Canada. There are substantial differences, as you know, in school context. So not only the built environment, but also the travel culture, the attitudes, the preferences, and that really translates into a need for local solutions to school travel planning. So instead of that sort of universal one size fits all idea. So I want you to know this is a suitable guiding framework, but there is lots of room within it to adapt to fit your school community needs. As for stakeholder involvement, this is also borrowed from Ontario Active School Travel, and it's important to note here that both school and regional stakeholders work together to create and implement plans that span across all 6 E's, which I'll talk about a little bit later. School travel planning engages local practitioners, policy partners, public health professionals, planners, traffic engineers, school boards, students, teachers, parents, police, RCMP, etc. I really should redo this graphic for our program, because our program was adopted from the Ontario model, which has school travel planning facilitators, so people like me that actually go in and work with schools, and their funding is given at a municipal or school district level. But in our model, you guys are really the STP facilitator there in the middle. So that's why we're clear at the outset that anyone applying to this project to be a project lead has a direct connection to the school. And it is really crucial to have the support of and involve in your planning principals, vice principals, teachers, some of you are project leads, and especially the students, that sort of top-down, bottom-up idea. So looking at this, while I am acting as a STP facilitator, it's actually my role here to build your capacity so that there is a more locally focused, sustainable effort, that sort of for us, by us, asset-based approach. And honestly, I do believe that with the COVID pandemic preventing me from being able to travel to schools is a blessing in disguise, because this isn't about one so-called expert coming in and telling you what works for your community. It's a more concerted effort made by you who are already in and know your community far better than I ever will, to involve as many perspectives as possible in your efforts. So sort of centering you as the school travel planning facilitator. All right. the meat of this, considering active school travel through an equity lens. So I'm sure that everyone here has some level of understanding of what we mean by equity, and that you could also probably teach me a little bit more about equity, so how you're prioritizing it in your schools. But I did first want to spend some time in this module discussing equity from a broader lens and bringing the concept into the conversation at the outset so that your project planning is informed by it. Here at BC Health Communities, we do have a fundamental commitment to equity, which to us means ensuring that systemic disadvantages don't get in the way of the community members' aspirations for their lives and the lives of their families. And we did adjudicate our applications for this program first and foremost through an equity lens. But what does that mean for how equity fits into our program itself? So several graphics have been used to illustrate sort of this concept between equity and the difference between equality and equity. And you've probably seen many of them. There are several with folks standing at different heights on different size boxes, sort of reaching for apples in a tree, or there's the one with many versions of the one where they're looking over into a baseball stadium. And my favorite is probably the one that also denotes the baseball stadium in what justice looks like. Justice actually takes equity one step further by fixing the systems in a way that leads to long-term, sustainable, equitable access for generations to come. But for the purposes of this program, I thought that this rendition by Robert Wood Johnson Foundation would be the most fitting and intuitive. So equality aims to ensure that everyone gets the same things in order to enjoy full, healthy lives. While equity involves trying to understand and give people what they need to enjoy full, healthy lives. The message here is like thinking that the same approach will work universally is like thinking like everyone is able to ride the same bike. So you can see in this graphic, when everyone is given the same bike at the top, it doesn't actually get them an equal outcome. So in other words, equity is a process and equality is the outcome of that process. The route to achieving equity won't be accomplished through treating everyone equally. Equity recognizes that each person has different circumstances and allocates the exact resources, opportunities, and power needed to reach an equal outcome. It's a complex area, but can be most simply defined as the fair distribution or leveling out of access to opportunities, power, and resources for all people, regardless of their age, race, ability, gender, background, etc. To me, though, the problem with this graphic and most of the graphics out there is that it sort of implies that equity needs to correct an issue that is inherent to the people themselves, so that people's bodies need to be accommodated into an existing system. So when we use this graphic as a metaphor for societal inequities, it's actually less accurate. The problem isn't inherent to the individual, it's rather society's uneven distribution of opportunities, power, and resources. And it's important to remember that societal systems aren't naturally inequitable, but they've been intentionally designed to reward specific demographics for so long that although the outcomes may appear unintentional, they're really rooted in discriminatory practices and beliefs. So a better version of this graphic, maybe one that we create eventually, would be one that shows like the ground underneath the wheels being uneven. Some folks having dirt roads, potholes, speed bumps. Maybe one's a completely separate bike lane from a road and it's on a nice smooth paved path, while another's a shared road. One doesn't even have a bike lane at all. Maybe one has a rainy day, sunshine, snow. It would just be better if it put the onus on systemic issues and different obstacles in various individuals' ways that have nothing to do with the individual themselves, but rather the systems within which society operates. And the bottom line here is that policies in the built environment are often arranged in ways that create barriers for individuals. So that brings me to my next point. This is called the determinants of active school travel, but the image is social determinants of health. This image was drawn by Sam Brad from Drawing Change during the 6th Gathering Wisdom Conference hosted by the First Nations Health Authority, First Nations Health Directors Association, and the First Nations Health Council, connecting over 900 delegates, including chiefs, health directors, provincial, and federal partners. So essentially, this social determinants of health framework expands on the idea of health from an individual to the bigger picture. So wellness is more than our individual choices. Whether you smoke, what you eat, how often you exercise, sure, that's important, but wellness is also affected by family, housing, racism, schools, community, environment, culture, connectedness, access to healthcare, gender, policies, etc. You can see the image. So really to kind of take this graphic and shift it and shift our thinking into this active school travel framework, though we might feel passionate about why more children and families should engage in active school travel, we also have to understand that it might not be a choice when it comes to someone's mode of travel. For example, if there's not access to a vehicle, then they might walk, but there's still more work to be done to ensure that that trip is safe. There are societal structures that are in place, like the fact that many parents' work schedules don't actually align with school hours. A parent might really value their child attending French immersion or a Montessori school, but they don't live within the catchment area or walking, cycling distance of that school. They may want their child to attend an out of catchment school because the school in their neighborhood rates low. They might live far away from their out of catchment school, from even their catchment schools, as you see in more semi-rural and rural areas. And they might just want proximity to before and after school care, for example. So really understanding children's travel behaviors requires being understanding of the many factors that aren't entirely in our realm of control. So both environmental and social and individual factors play a role in either facilitating or discouraging active school travel in children and youth. And parental characteristics, attitudes, perceptions of environment, et cetera, they all influence a child's mode choice. So not as an exhaustive list, but overall, some things that encourage and facilitate active school travel include the presence and quality of sidewalks, residential density, connectivity, pedestrian signage, presence of bike lanes, trails, speed bumps near the school, traffic calming, and being a boy. Things that discourage active school travel or make it more convenient to choose to drive include living further than 1.6 kilometers for walking or 4 kilometers for cycling, traffic danger, traffic volume and speed, crossing a busy road. Some of you have mentioned that. Lack of traffic lights, adverse weather conditions, high traffic volume and speed, neighborhood aesthetics, parental concerns, strangers, bullying, fear of abduction, being a girl, and convenience or trip training. As far as socioeconomics go, sociodemographics, ethnic minorities, low income, families with one or no car, families that have a stay-at-home parent, or lower socioeconomic status really increases active school travel regardless of the built environment, making it more likely that a child will use active school travel. And then on the alternative, high car ownership, high household income increases the likelihood of passive school travel. Higher education status, dual income families, busy work schedules, fear of safety, that sort of thing negatively correlated with active school travel. The literature suggests that the built environment matters more with longer trips and the social environment matters more with shorter trips. And so that shorter trip thing can be shifted more with program interventions. The good news, though, is that we can do things to really get at these determinants, and it involves a balance in educational initiatives, urban design modifications, societal changes and attitudes, really getting parental and student input prior to the development of your programming so that you can target issues with greater potential effectiveness. Successful active school travel planning programming involves top-up and bottom-down, top-up support and bottom-down involvement. So top-down support and bottom-up involvement. I'll get that right at some point. If you think that back to that first diagram with the context of everything that I've talked about, since we do have a little bit of time, I think, thinking back to that first diagram. So really, how did this happen? What's more than just saying, well, the built environment's different, social circumstances are different? What really is the root for this particular family? So George Thomas, he's the great-grandfather. He was 8 years old, walked everywhere. His parents were unable to afford the fare for a tram, let alone the cost of a bike. So he regularly walked 6 miles to go fishing without adult supervision. Fast forward to 2007, his 8-year-old grandson enjoys none of that freedom. He's driven a few minutes to school, takes a car to a safe place to ride his bike, and can roam no further than the end of his street. George is now 88. He's still a keen walker. His son was 8 in 1950, and he was allowed to walk for about a mile to the Loga Forest. He did walk to school. never traveled by car. By 1979, his daughter was 8. There were signs that children's independence was really being eroded at this point. She would ride her bike around the estate, play with friends in the park, walk to the school, walk to a swimming pool. And there was a lot less traffic then than there is now. So many families only had one car. People didn't really make all of these short journeys via personal vehicle. So today, her son spends little time outside on his own in their backyard on their quiet suburban street. She takes him by a car to school to ensure that she can get to her part-time job on time. Her son, does enjoy things like piano lessons, skiing, holidays, the trampoline. He's got a climbing frame in his yard, but his mom is concerned that he might be missing out. He doesn't tend to go out because other children don't. They put a bike in the car and they go off into the country so that they can all cycle together. It's not just about time. Traffic is an important consideration, as is the fear of abduction, but she's not sure if that's real or perceived. And in the mother's words, over 4 generations, their families are poles apart in terms of affluence, but she's not sure that their lives are any richer. Bringing all of this to the context of what our pilot approach is, we'll learn more about these 6 E's in Module 3, but I just wanted to introduce these concepts at the beginning. So while many school travel planning programs now use some range of these 6 E's, our framework really centers equity and looks at the remaining 5 E's through an equity lens. And applying that equity lens means that in the beginning, for example, we consider how to reduce the barriers that we've talked about today when we're planning our engagement processes. A conversation really needs to be had early and often, which is why it's included in this very first module. So in traditional engagement processes, consider questions like, who benefits from the impact of a given decision? Who's negatively impacted? Who isn't even there? Which voices are missing? Participation and engagement, and including more voices in the decision-making process, not just inviting your community, particularly equity-seeking groups, to have a seat at the table, but thinking about building a new table with everyone. So when you think about that stakeholder involvement diagram that I shared earlier, who should be selected and what barriers can you remove to make your planning more accessible, your involvement of others in your school community more accessible? So what if we treated people with lived experience, those context experts, the same way that we treated content experts, for example? And we're going to look further into this public engagement spectrum a little bit later on in the curriculum, but just want to say all this to say that you really can expect a big focus on equity throughout our programming. Equity is that circle that we're including everything that we do into. I will have this at the end here if I have time. So I'll take a couple minutes just to go through, but essentially kind of taking the ideas that we have talked about, centering you as the school travel planning facilitator is that core value of capacity building and empowerment. There are really many benefits to using a healthy communities approach, and this is a diagram that was built by BC Health Communities and really responsible for the inception of this organization a long time ago. In coordination with some other folks, but there are many benefits that really come with using this healthy communities approach, providing community members with an opportunity to voice their concern, learn about complex issues, and develop innovative solutions. And active school travel really is a complex issue. We need to develop innovative solutions. So local government service providers are able to draw on insights and energies from residents, which inform the development of healthy public policy. We can consider things like having a school policy on active transportation. Healthy community activities lead to outcomes at both the individual and provincial or national level, such as healthier lifestyle choices, improved health status, increased knowledge, skills, expertise, stronger partnerships, cleaner physical environments, a growing economy, and healthier, resilient communities. And those are all things that we're seeking to incorporate into our work and achieve through this pilot program. So with that, it's 11:43, some time for everyone to discuss. Do you have questions? I'm gonna stop sharing my screen so that I can see everybody. If you wanna if you feel comfortable, put your video on. And then I can pull up the chat. Okay, I hope Jesse's, cool. Michelle, you got in. All right, I know some of you were on the team side. Sorry, that's probably a result of me sending out this invite again because I was having issues with Outlook and it's an automatic thing that I have to turn off. So my apologies if you were on the team side of things, but welcome to the Zoom and hope you got here early enough in the presentation. One of the questions I can see in the chat is, do you have data for 2020 and 2021? Participation data is up to 2020, I believe. So yes, but really and truly, data on how kids get to school is pretty sparse. And so even when you see those numbers, like the percentages that are using active transportation to school, they're based on pretty small sample sizes. And that is something that the Active School Travel Canada board that I sit on is looking at, how we can work with like the CAA, for example, to potentially collect a real bigger scale of information from Canada to be able to say with confidence what the numbers are. And so that's something that we're looking into. But yeah, the data itself is tricky and comes from kind of smaller sample sizes. So yeah. Does anyone else have questions, comments, considerations?
I was just going to say, I really enjoyed the map with the great grandfather and his descendants. I think that'll be a really great thing to show some of the kids and go around to the classrooms to get them engaged. Yeah. I think they'll be really keen to know the way that things have changed and to get some insights from them about our little community in Kimberley and like how that might play out in their families.
For sure, yeah. Just using that as a starting off point for, you know, getting them to have conversations with their parents, their grandparents, and how did you get to school, and really starting the conversation. I think, you know, going back to the beginning, talking about the why and how the why doesn't necessarily close the deal, but it does open the door to conversation, and one conversation at a time, and more of those conversations you have, those folks are going to go have other conversations, and that's really going to continue to bring more people into this circle. So yeah, I'm happy to share links to that, and as well to the book that diagram is discussed more in. I guess does anyone else have questions?
I think it'd be interesting to go around and say like what our why is. Super quick.
Yeah, that's what I have on my list. So
awesome.
I'm either gonna say, what's your why? What, you know, why did you choose to be a project lead? Why is this important to you? Or if you have any experiences, or if those in your community have experiences that you are permitted to share about that are related around equity in school travel planning or school travel as a whole. So, you know, there's lots of folks in the room. Everybody here has some experience with this, right? You're here for a reason. So I could go on my screen, or if you guys just want to raise your hands or unmute. Or hi, Karine.
Hi. I can go first. That's why I put my video on quickly.
Sure.
I'm actually here. I'm the Healthy Built Environment representative with Fraser Health. So I support the program in all of what we call the Fraser South communities, which include Surrey, Delta, White Rock, and the Langleys. And I'm actually here supporting our Delta folks today for Gibson Elementary. And just wanting to listen in and see, you know, what everyone else's why is and what exactly they want to do with the program. In terms of my background, I have done a few projects with active school travel planning. I've worked with HASTE in the past. So I've done this for a few years. And I basically just want to see, you know, with the support through BC Healthy Communities, how I can be of a further support to our school in Delta, and how we can work together and help them to make this a successful project.
Awesome. thank you so much for joining. It's really, wonderful that schools are already in, that was part of the application process. So what are the partnerships that you want to develop, and having folks like you who have this experience on the ground, that's awesome, really helpful.
Yeah, it's exciting. Yeah, thanks for having me.
Absolutely, yeah.
I'll go. Just that I was surprised looking at your whys. Mine is community more so than the others.
Awesome, thank you. Does anyone else want to say what their why is?
I can go. I think the why for me in getting involved was just to give the community and our school community, as well as the parents. A lot of the parents have been feeling disconnected from their kids and what's going on at school as a result of the pandemic. And I thought that this project would be such a good way to help families feel connected again to what's going on at school for their kids, and quite literally connecting them like geographically between school and knowing, what does that trip like for their kids, and how adding the active piece can really, as you mentioned, there's so many different benefits. Can't really be underestimated. So just getting that message home and supporting them in kind of getting around those barriers that some of them might be facing, for sure, because we're definitely in a time of growth here in Kimberley. We have about 8,000 people and it's like exploding all the time. So, it's a really good opportunity. Even the city is making a really committed 10-year plan to improving the infrastructure. So the timing is really, really good for us here.
Yeah, that's awesome. And related to your point about the pandemic and how that's changing the way that parents are able to engage in school communities and things, we definitely saw a really wide range last year, where in some cases the pandemic kind of limited their ability to get volunteers and things like that. But in other cases, actually, the pandemic was an asset, because it was one rare opportunity where you could be outside engaging in something. So we had one school that ran a school streets pilot, and they couldn't get enough they had to limit their list because people were just so eager to do something at the school. And so I'm hoping that that's something that you see through this, or maybe we're at the end of it, who knows. But yeah, thank you so much for sharing. Does anyone else want to share their why?
I'll go. We are, me and Raymond Mba, who's on the call as well, he's the principal of the school. We are from very far north from a lot of you probably. We are Takla Nation, and it's very isolated. We do not have paved roads. It's still dirt roads, potholes. There are no proper street names and all of those street signs and whatnot. So we are very like on the land, on the ground. But what I think for my why is to promote that physical fitness and the health of walking and biking to school. I think our students are getting into the habit of, inactivity, gaming, social media, and it is becoming a problem. So I think that we're going to have to really be creative with how we get our students to choose to walk or bus or bike instead of taking the bus, because we do offer a bus service to our kids. So we've spoiled them, and only because we do have times when bear come, in the spring soon, they'll be coming out of their dens and walking through the community. So, for safety wise, there is that, but also, we'd have to be creative with how we convince them, to walk and how to do it safely.
Mm-hmm.
And I don't know if Raymond, if you want to add anything.
I believe you've provided a brief summary of why we are in this program. So I do not have much to add at this point.
Okay, awesome. Well, thank you so much for being here. It's nice to see your faces and meet you both. And we really do look forward to working with you. And there's different contexts and different issues that you're facing compared to some other schools, but we definitely have resources, for that. And we also have some other schools that participated last year that are continuing to work with us. And I'd love to connect folks together based on, you know, what you're going through versus what other pilot schools that we worked with and are continuing to work with last year are doing. So at some point we will bring everyone together, and otherwise, if you're open to it, I can definitely share contact information with their permission, of course, when I connect with that group again. But yeah, you've brought up some really good points there around also thinking about social media and phones and that sort of thing, and screen time and what that does to the landscape of an environment, and particularly the safety of pedestrians using, you know, walking across the street, looking at your phone and you're not paying attention to what's going on, or driving a car and that sort of thing. And I'm definitely pulling resources that will help with how to educate around those types of issues. So yeah. If maybe one other person wants to share, and then if not, we can go to our next steps. But...
Yeah, I can chime in here. I think to sum up my why in one word, the one that comes to mind is empowerment. And I just really love the idea of allowing or helping to enable families in our school community to just have more decisions at their disposal. So they're not looking around and just seeing cars doing drop off, or they're not looking and seeing, you know, unsafe, you know, busy urban streets. And so I guess empowerment in terms of presenting more choices and whatever works for each of their families. And part of that, the equity piece is, you know, access to some of these human powered modes of transportation across the pretty diverse, you know, socioeconomic, I guess, spectrum of where we are. So that's what came to mind.
Absolutely. Yeah, that's really wonderful. Thank you for sharing. It's important. Empowerment is a really important piece to what we're talking about. I appreciate those comments for sure. I'm just going to go back to sharing my screen here. And can you all see that now? I say y'all a lot because I lived in Texas for 2.5 years. So here we go. Next steps. So if you have not yet received an invite to the Google Drive folder, please email me. Let me know. You should have gotten an invite to that last week. In that is where we'll file things like this presentation and links to any other resources that are pertinent to each module that goes in there. So it's already there. If you haven't got an invite, it looks like there's a lot of confused faces on here, so maybe nobody got that invite. And then I need to figure that out. Is that nod your heads or yes? Did anyone get an invite? You did. Okay, good. Okay, there's just some folks that are missing one. All right, so email me if you didn't get an invite. We'll sort that out. There is some resources in there now, and I'll be adding Module 1 resources as well. Onboarding calls. If you haven't yet reached out to schedule an onboarding call with me for next week, please email me times that your entire project team is available, and if possible, including a principal if they're not one of the project leads. It'll be a 30-minute call, and I can also schedule those for either February 14th to 18th or 21st to 25th. So shoot me an email once you've collaborated with your team and know times that will work for all of you. And then upcoming modules. So because of the way that spring break is falling differently at different schools, there's 3 weeks in March where we don't come together as a group. And that means that we got to schedule 2 modules prior to that date. So you should have gotten the module 2 invite. That will happen on March 3rd. And I'll be sending out the module 3 invite shortly. I just had to confirm we're going to have a guest speaker come in for part of that. So I wanted to confirm with her before I sent out those details. And like I said at the kickoff meeting, I'm a quotes person. Thank you so much for being here today. we did finish on time, which is wonderful. These are two quotes that I think can stick with us. This first one, it kind of came out of this idea with Enrique Penalosa. He's the former mayor of Bogota, Colombia. And he was talking about the common measure of a mountain stream is you look for trout. And so if you find trout, the habitat's healthy. In the same way for children in a city, children are that sort of indicator species. So we can build a city that is successful for children, then we've built a city that is successful for all people. And then the second one there, Nelson Mandela, history will judge us by the difference we make in the everyday lives of children. So if that is true, hopefully we're all being judged positively. As always, reach out to me, any feedback you have, scheduling those meetings, improving those sessions, what worked well, what didn't, etc. Please feel free. I have an open book to share those things. I can handle positive and negative feedback. So thank you so much for being here. I'll be in touch, and I hope everyone has a wonderful day.